Hi, my name is Umar Joe. I'm an environmental consultant, and in light of World Health Day, which is observed on April 7th, I just wanted to speak briefly about the relationship between air pollution and health, especially as it pertains to us here in Trinidad and Tobago. I want to focus on three things: the main contributors of air pollution here, its impact on our health, and what we can do as a people to safeguard ourselves and prevent it. The United Nations Environmental Programme identified TNT as one of the most polluted places per capita in the world. Additionally, according to a 2017 publication by the eco-experts in the UK, Trinidad and Tobago is ranked as the 10th most polluted country on earth. This is due largely in part to bushfires, the burning of rubbish, and our vehicular traffic emissions. Paint shops and industrial emissions also play a role, but the lion's share of pollution that affects you, me, our parents, kids, neighbors, and grandparents can be controlled by us. When people burn rubbish, light bushfires, or leave their vehicles idling, especially diesel vehicles, there is an immediate danger to your health, both in the long term and the short term. When you think of air pollution and how it affects the human body, you tend to think of short-term health impacts like acute respiratory failure or difficulty breathing. However, while that is extremely dangerous, what is also extremely dangerous are the long-term effects. Cancer, the increased risk of dementia, circulatory problems, and organ failure are all associated both directly and indirectly with air pollution. And we're not just talking about lung cancer, we're talking about a myriad of cancers related to air pollution. In fact, statistics coming out of our healthcare sector have shown a marked increase in cancer-related cases and deaths in the past 10 years alone. Of course, developing cancer is multifactorial in nature, but numerous studies worldwide are showing just how significant the role of air pollution is. We are seeing it more and more, not just in older people and vulnerable people, but in young adults as well. So what can we do as citizens to safeguard ourselves? Well, we need to fight the battle both externally and internally. Externally means controlling how we interact with the environment. Stop burning rubbish. Switch off your vehicle when you can. We need to be our brothers and sisters' keeper. In any community, be considerate of others. We also need to lobby to our leaders to regulate and enforce stricter measures as it pertains to industrial emissions, vehicular emissions, land use management, and fires. Unless there is a controlled methane capture solution present, no burning should ever take place. You might also want to talk to your regional corporation or representatives to facilitate better closed and open tray garbage collection schedules. This makes burning rubbish less likely. With all these measures, however, there are still some things outside of our control, so we need to build up our bodies to resist disease. You need some form of exercise every day. Avoid fast foods and processed foods. Limit your alcohol intake. Yes, alcohol is a known carcinogen. Limit your red meat intake. Maybe try to eat more fish. Research what a Mediterranean diet entails. I won't be able to say everything here, but Google is your friend. And if you're interested in learning more, or you need help, send me a message on Twitter.